Hello, and thank you for joining me for the last session of this educational series. If you missed it, over the last 8 weeks, I have already covered information on postpartum physical and mental health, NICU care, attachment, development, sensory processing, feeding, and self regulation. If you want to catch up on those sessions, you can find the link for each one on our website, which I'll have included at the end of this presentation. If you don't know me, my name is Grace, and I'm a third-year occupational therapy student at the University of South Dakota. This educational series is being provided as part of my final capstone project. I myself am a mom to a 1-year-old, and for occupational therapy, we focus on what we call occupations. These are the activities or the things that we want or need to do in a day. So some of my favorite occupations are playing with my daughter, going on walks during sunset, and binge watching TV shows with my husband. If you're tuning in on our YouTube channel, I would greatly appreciate if you are willing to fill out this pre-survey. I'm looking for any data that I can get, and it's brief, anonymous, and just aims to show me how effective this session was. These are the topics that we're going to cover during today's session, so we're just going to jump right into talking about what is autism. Autism spectrum disorder, or ASD, is a neurodevelopmental condition that affects communication, social interaction, and behaviors. The term neurodevelopmental essentially just refers to abnormal brain development and functioning, which results in differences in the areas that I just listed. ASD typically presents in early childhood, although some individuals may go far longer without receiving a diagnosis. When we use the term spectrum, this means that there are just so many different symptoms, strengths, challenges, and severity levels of autism that no two individuals with autism are going to be exactly the same. So I want to start with talking a little bit about some of the statistics behind autism. According to research, nearly 1 in 36 children are diagnosed with autism in the United States. And from what I found in my research, this can vary from state to state. Some states have a much higher diagnosis rate, where in other states it's much lower. I think that this can be contributed to the environment, because the environment you are born in and grow up in definitely plays a role. But I also think that access to testing services and the amount of support for these services also plays a role in that diagnosing. Additionally, boys are 3 times more likely to be diagnosed with autism than girls. And again, I think genetics can play a big role in who has autism, who doesn't. But research has often shown that girls fall between the cracks more often because they either present more kind of mellow, or their symptoms are just not seen as problem behaviors. This is very common as well with girls with ADHD. And then finally, according to research, the average age a child gets diagnosed with autism in the United States is around that 4-year-old mark. Some defining characteristics that is generally seen in children with autism include different communication styles. So this can mean even some kiddos are nonverbal, but even for kiddos who aren't nonverbal, this can be things like that nonverbal communication. So making less eye contact. They may not fluctuate their tone of voice as much as we would expect them to. Individuals with autism typically have a preference for structure and routine, and they often experience higher sensitivity to sensory input. So things like loud noises or bright lights or tags in their shirt can make them overstimulated much faster than what you would expect on a quote-unquote normative individual. Individuals with autism typically have topics that they develop very deep interest in. And so this may be something like a TV show or a video game or a toy. And individuals with autism have unique ways of problem solving and learning that they may approach a problem who someone else without autism would be less likely to approach it that way. I just want to list a few examples of the social interaction characteristics. So, with this social communication differences, we can see things like avoiding or not keeping eye contact. Early on, we often see kiddos who don't respond to their name by about 9 months of age. That's usually one of our first indicators to screen and evaluate for autism. Kiddos who don't show much facial expression, so their face kind of remains the same whether they're happy, sad, angry, surprised. And this is again by that 9 months of age. And then for kiddos who are 12 months of age, it's kind of a warning sign if they're not doing interactive games like patty cake by 12 months, if they're using few or no gestures, so like pointing to things, that would be, or like waving goodbye, that would be like a gesture. And then in terms of the kind of clear structure and consistent routines, a lot of times with autism, that's where we see restricted or repetitive behaviors. So they have significant difficulty with change and they like to behave in the same way over and over and over. So some examples of this are like lining up their toys or other objects, and if the order gets changed, they get angry or upset. A lot of times we can see kiddos or individuals with autism that have what's called echolalia. This is essentially just when they repeat words or phrases over and over, or if you were to say something to them and they just repeat it right back to you over and over, that's echolalia. Playing with toys the same ways, or that they're focused on certain parts of an object, so like the wheels. And yeah, so next we're going to talk about the levels of severity. So autism diagnoses are typically broken up into 3 different levels. Level 1 is considered to be that lowest level needs, really. It's still requiring support, but it's that lower level. Individuals with this level, they do have challenges in that social interaction, and these challenges are more noticeable if they don't have any supports in place. But if supports are in place, then these challenges are typically far less noticeable to individuals outside of the situation. These kiddos often show less interest in social interaction, but they can cognitively speak in full sentences. They just have a harder time with taking turns in conversation or wanting to strike up conversation or knowing how to strike up conversations. In this level, it is noticeable that a child is having difficulty with flexibility and change. Level 2 is considered needing substantial support. So, in this level, individuals experience deficits in verbal and nonverbal communication skills, even when supports are in place. So, these kiddos, even when they have the support that they need, the services that they need, they are still struggling with this. These kiddos often speak in more simple sentences, but when it comes to their special interests, they're not afraid to dominate the conversation. And they just generally don't engage in what we consider to be normative communication. So, again, things like eye contact, changing our tone of voice, using facial expressions, things like that. These kiddos have significant difficulty with change where it impacts their ability to function in a few different contexts or settings. And finally, level 3 is the highest level of support, and these individuals generally experience severe deficits in verbal and nonverbal communication. So they may have very few words that others understand, and they significantly limit their social interactions with others. In this level, these kiddos have extreme difficulty with changes in routine, to the point that it's noticeable in almost all areas of their life, not just a few different contexts here and there. The direct cause of autism has not been determined, although research shows that it's likely a combination between genetics and environmental factors. Some risk factors for autism may include parents' age, so parents who are older. Um, the research that I found showed that babies that are born to parents over the age of 35 is typically kind of where this comes in. Additionally, the risk increases for individuals who have a family history of ASD or any other genetic or chromosomal disorders. So I listed a few examples here. So things like Fragile X syndrome or Down syndrome. The risk increases as well with pregnancy complications. So things like hypertension, obesity, diabetes, or any exposure to substances. With this, again, we talked about autism as a neurodevelopmental disorder, so impacts to that brain development, and these complications can impact that brain development in utero. And then along the same lines, kiddos who are born very early or a very low birth weight, it can impact their risk factor for autism due to the changes in the brain development, likely due to an early birth or not gaining enough weight. Risk factors alone do not cause autism, but when combined with other factors, it can increase the likelihood of ASD significantly. I want to go over just a few of the myths that are floating around about autism. So the first one that I have listed here is that autism can be cured. As we've talked about when defining autism, this is a neurodevelopmental disorder. So it means that the brain developed differently, and so it's impacting one's ability to function. There is no current cure for the way that our brain develops differently, although things like early intervention therapies and medications can help develop some of those therapies can help develop some of the social skills, improve emotional regulation, and help build adaptive responses. And then the medications, they can't really help along those like social skills side, but they can relieve some of those symptoms, like with the emotional regulation. There are medications out there that can help children kind of be a little slower to react. Second, children with autism do not like to socialize. That is a myth. While this can be true for some children, like I said, it's not a one size fits all. Most children do have a desire to make friends. They just have difficulty doing so due to their differences in communication and social skills. And this oftentimes leads to a lack of acceptance from peers. And finally, individuals with autism are dangerous. This is a myth. It is very rare for a person with autism spectrum disorder to act violently out of malice. So typically, those violent behaviors are due to frustration, which might be linked to sensory or physical overstimulation. There are so many other myths out there that I did not cover. So if you want to learn more, there's plenty of research on each of these that I covered today, but also the several others that exist as well. I want to go over just a few signs, those early signs that you can see that might warn you or flag you that there might be a concern for autism. So oftentimes with children with autism, they show symptoms in that early childhood, like I said. Research has shown that they can start showing symptoms honestly as early as 12 months old. That's really when our language and communication skills start to blossom, and so these signs become more apparent. I have heard in my experience in an outpatient pediatric clinic that some places like to wait to evaluate for autism until closer to that 3-year mark, but it is still possible to get diagnosis sooner, and the reliability of an ASD diagnosis is at around 80% by 14 months old, and it only goes up from there. Some early signs to watch out for. So I talked about a few of these on that key characteristics slides, like the not responding to their name, things like that. But I'm going to talk about just a few more. So you want to watch out for whether your child has limited interest in playing or interacting with others. So something we do have to consider with this is age. When kiddos are younger, like that 12, 14 month, like we've talked about, a lot of times they're not wanting to play with other kids. They're still in this stage of play where they play by themselves, maybe next to other kids, but a lot of times they're not going to play with other kids. Older children, however, they should typically, we expect them to be playing with other children. So if they're not, that can be a red flag to you. You want to look for things like reduced verbal and nonverbal skills. So with the nonverbal skills, are they making eye contact? And I just want to say, like, eye contact is not the only key indicator of autism. A kid might make great eye contact and they can still have autism. And then, yeah, delays in speech or language are usually a red flag. And I think a lot of times this is that first indicator to parents that they might need to get a little bit extra help. Repetitive behaviors or movements that kiddos like to just do over and over again. So, hand flapping or rocking themselves back and forth or lining up all their toys in a neat line. Difficulty with changes in routines. So, if a daily routine changes even a little bit, it oftentimes will lead to a meltdown. And then finally, we talked about a little bit before, just those sensitivities to sensory input. If it seems like your kiddo is really struggling with that oversensitivity to the tags in their shirt or to the lights or the sound or textures, a lot of times kiddos with autism do have difficulty with feeding as well because they're oversensitive to that sensory input, and the different textures of different foods can really mess with them. And then over on the slide on the right hand side, there are some just examples that you can kind of follow that are early signs. In order to get a diagnosis for ASD, a specialist does have to be able to conduct an evaluation, but usually that first step is going to be through your child's pediatrician. When you do your well check visits and they ask you about their development or they have you do the forms about their development, that is where they're screening to figure out how is your child developing. Is there any concerns that they've lost any skills that they once had? Or are they significantly delayed in their development? Because these can pop up as red flags, and hopefully they can catch those red flags early. And if they do notice anything abnormal, then they can refer out to a specialist who can perform an evaluation and give a formal diagnosis. I think a lot of times when talking about autism, there's almost like this constant focus on the challenges, which is not necessarily a negative thing. We want to highlight the challenges that people with autism are going to face because that's unfortunately just our reality, but we also want to put an emphasis on the strengths as well. Individuals with autism typically have a very strong memory and attention to detail, especially for the topics that they're interested in. They're creative and innovative, especially in how they choose to play with different toys. In the outpatient peds clinic that I was in, it was amazing to watch some of these kiddos interact with the different toys in ways that I've never seen another kiddo do it. With their desire for routine, they are dependable with routines and schedules. They can hold their concentration for long periods of time, especially when they're motivated by the topic, so if it's one of their special interests. And they do have significant expertise in those special interest areas. It is so important, like I said, to highlight the challenges because unfortunately, the reality is that our world is not necessarily built to be inclusive for all. So individuals with autism, they might experience challenges with participating in daily activities due to sensory overload. So things like the bright lights, the loud noises. Kiddos with autism going to a birthday party might be significantly more difficult than a kiddo who doesn't have autism. These kiddos are often misunderstood during social situations, so this can significantly impact how they work in the future, how they learn, or how they socialize and make friends. And finally, individuals with autism may have difficulty understanding others as well, which can lead to a lack of acceptance from peers. And I just want to give a few small strategies that you can kind of start to work on with your child at home to help promote functioning in the setting. So, first, using visual schedules can be so helpful for children in general, let alone children for autism, just all children. But this is especially satisfying for those children who love their routines, which, as we know, oftentimes is children with autism. These visual schedules help children learn to sequence and complete activities, and it can bring in some motivation to complete activities that might be a little less interesting. Also, at home, you want to try to keep routines as predictable as possible. I know it's not always possible to do every single day exactly the same, but keeping things like morning or nighttime routine the same. So a kiddo knows that when it's bedtime, we go upstairs, we take a bath, we brush our teeth, and we get in our pajamas, we read a book, and we go to bed. Keeping that as close as possible to what you're used to doing can really help reduce meltdowns. And then at home, you as their parent, you want to encourage and model interactions with others so that you can show children how you change your tone of voice when you're talking, how your facial expressions might change, and how you might engage with someone else, how you start conversations with someone else, how you take turns in a conversation with someone else. Children learn most of what they learn through observation, so this is really, really important. And finally, follow your child's lead. I think so many people like to say that individuals with autism, again, like we talked about with that myth, that they don't like to interact socially, but how many people really take the time to just sit down and follow their lead rather than try to force them to be what we consider as normal, quote unquote. So sit down, engage with their special interests, and just see where it takes you. And you can really start to see that creative and innovative thinking when you just sit down and watch where they take it. This will really help you show them that you care about them and you care about what they care about. Occupational therapy, like I said, focuses on those occupations. So OT plays a vital role with individuals with autism. Due to OT's focus on those everyday activities that we want or need to do, we can help individuals with autism develop the skills that allows them to participate in these activities across different environments. Some techniques that an OT may use for a child with autism include social skill development, so helping children again just understand those normative conversation skills like how to start a conversation, how to drive a conversation, what's the appropriate amount of time to talk before you give someone else a chance to talk? And if someone changes the topic to something that you're not so interested in, how do we continue to engage in that conversation so that that person doesn't feel upset? OTs can help explore different play techniques that might help a child expand their interests or help them engage in with other children, so play groups, things like that. They can implement and educate on sensory activities and visual schedules. These both help promote regulation. They can help individuals develop skills for daily living, so teaching them skills like dressing, eating, etc. And OTs provide all of this information, all of these techniques, and so much more through parent education and parent support. Um, this parent aspect really ensures that there's carryover into the child's environment because this is where the most success is going to come from is when parents take the information that they're given and they implement it at home. So this is the handout associated with this session. It's all things that we talked about today. If you did take that pre-survey, I would greatly appreciate if you take the post-survey as well so I have a complete set of data. Again, it's brief, it's anonymous, and it just shows me how effective this session was. This link in blue is going to take you right to our website where you can find all of the materials from today's session and all of the materials from all the previous sessions as well. This QR code, if you scan it, will take you to a list of Cheyenne local resources, so things like therapy clinics, mental health clinics, and so much more. And this is my list of references. If you tuned in for even just one session, half a session, or all 9 weeks full of sessions, I appreciate your time and your interest in my capstone project, and I hope that you continue to visit this website as it'll be up long term so that you can continue to gain and use this information for future use. Thanks so much for tuning in.